Good evening and welcome to the Adults and Health Overview and Scrutiny Committee meeting. It's the 26th of February and it's now 7 p.m. and I would like to start the meeting. I would like to draw your attention to the evacuation procedures which can be found in the agenda under the information for members of the public and councillors section. I would like to remind you that under the Overview and Scrutiny Procedure Rules, Part 1, Paragraph 10, as set out in the Constitution, this meeting shall have a maximum duration of 2.5 hours. Therefore, if at 9:30 p.m. there are items remaining, the agenda item under consideration will be concluded within 10 minutes, followed by a vote, and items not yet considered may be deferred to a future meeting. I would also like to remind everyone present that this meeting is being live streamed and recorded for publication on the Council's website. Item 1, apologies for absence. I have received apologies from Councillor Day, Councillor Fish and Councillor Muldowney. We've got Councillor Sisterton substituting for Councillor Muldowney. Thank you. Are there any other apologies? No. Okay. Item 2, the minutes. I move that the minutes of the meetings held on the 15th and 27th of January, as outlined in the agenda, are approved as a correct record. Are there any comments on the accuracy of the meeting? Okay. The minutes are approved. Item 3, declarations of interest. Does anyone have any declarations of interest to make? Okay. Item 4, unplanned scrutiny items and members' rights of reference. I've not been notified of any unplanned scrutiny items or members' rights of reference. Right. Item 5, this is the East of England Ambulance Service performance, which is on pages 21 to 32 of the agenda. Thank you for coming this evening. The reason we've asked the ambulance colleagues to come along is because recently they were sort of, I think, the worst performing ambulance service in England, which was due to the Category 2 response times and cultural issues. So hopefully we can learn a bit more about how they're addressing these issues tonight. If you'd like to present the report, please. Thank you.
Thank you very much, and thank you for inviting us along here today. Myself and Mike Bates will be very happy to take any questions on the paper, but I thought it might just be helpful just to introduce the paper to begin with. So as you've indicated, the East of England Ambulance Service has had a track record over the last few years, both struggling with their response times, but also some of the cultural issues and hence the impact on our staff surveys that have materialised. And that has contributed significantly to the assessment that's been placed in the National Oversight Framework, and we've been assessed as National Oversight Framework Level 4. And that places us initially during the summer in the worst position in the NHS, but as we have seen the improvements that we've been making in the latest quarterly assessment, we've now been placed 9th in the league table of 10 organisations in England. Some of the contributing factors which I've already mentioned relate to our response times, and I can give you some of the impact that we've been making over the last 12 months, but also some of the work that we've yet to do. Included in the paper, we've demonstrated through those calls that are the most critical, if you like, the C1 and C2. The C1 calls relates to those patients that will have, they may have had their heart stopped or they've stopped breathing. And those represent clearly our most critical patients, and they have an expectation of a response time within 7 minutes. And within this patch, we have seen performance in 2025 of 8 minutes and 8 seconds, which does represent an improvement on the previous year, which was 8 minutes 30. And then similarly for our C2 calls, we have seen an improvement. So against a standard that the NHS was asking us to deliver of 30 minutes in the last year, we have seen performance for our C2 performance of 38 minutes and 21 seconds. Now, that compares to an improvement on the previous year, which was 41 minutes. But it hasn't seen the level of improvement in this sector that we've seen across the whole organisation. In part, and I'll come back to this, we believe that one of the significant contributors to that is the handover delays in the hospital, but I'll mention that. What I did want to do is just to articulate some of the areas of focus that we've been concentrating on. The first of which is trying to ensure that we're navigating patients to the right place. So as I'm sure councillors will be aware, that not every patient that rings 999 requires an ambulance. But typically we have seen many patients that have seen an ambulance dispatched to them. We've been working hard to try and ensure that we have recruited a number of people into our clinical assessment service that enables us to make a judgment as to whether that patient indeed does need an ambulance, and look to navigate those patients to the right place first time. And that has proved to be quite successful. We have seen an increase in those patients that require, that have a hear and treat disposition increasing in the last 12 months. And that is equivalent now to around about 18%, which we see on a regular basis. Secondly, we've also been looking at those things in which we can improve our productivity, for want of a better word, making sure that we're improving the on-scene times. And sometimes that means that our ability to be able to call on other clinical professionals that would enable us to make a judgment more quickly than remaining on scene for any period of time. But we've also been trying to support, so say, that clinical and leadership decision support. But that has included some other things as well. So obviously we're reliant on our fleet being very productive as well. And we did have this time last year quite a high volume of our vehicles that were off the road. We've improved that considerably. So I think the peak last year was around about 40% of our vehicles were off the road. And I can say that confidently now that we're regularly performing at around or just over the 20% mark, and have ambitions to continue that performance improvement. And that does mean that we're able to get more crews out onto the road seeing patients. We're also looking at how we can prevent some of those patients then going into hospital that don't need to be there. And of course, sometimes it's very easy to see that once the patient has been into hospital, and the consultants may have seen the patients, but working with them to understand the disposition of that patient and the outcomes for those patients, to feed that back to our staff, and to ensure that that changes our clinical practice. Because I should add that my background has largely been through the acute hospital sector, and that one of the things that struck me in coming into the ambulance service around 18 months ago has been the lack of feedback that is typically provided to patients once those patients go into hospital. So we might have a working diagnosis, if you like, based on their presenting symptoms, but that link up with other organisations and the understanding of how we manage those patients is something that we have been improving. I did say I'd come back to the handover delays, and that has been a significant factor in this year. So this time last year, we had ambulance handover delays that were in place, and were in excess of the 15 minutes that we have. That is the 15-minute target, if you like, is a national standard that we have been looking to ensure is in place. And we last year were around about 26 minutes, but that has increased this year to around 36 minutes. And you can see how big an impact that has had on our performance, where the performance improvement across the region has been substantially higher than it has been in this patch. And we understand that to be a big contribution to the reasons for that. So that really relates to the performance aspects of that. But as I've mentioned, the cultural improvement in the organisation is a very critical part of what we've been doing. And certainly in the last 12 months, we have been undertaking a number of campaigns to improve that, starting with some new values and behaviours that we've established in the organisation through a big engagement with our staff in developing those values and behaviours, but also have launched a sexual safety campaign, which has proved to be very successful. And we now find that many of the staff that perhaps were coming forward with some very serious concerns 12 months ago, we're now seeing those, not only those serious cases reducing quite considerably, but also the total number of issues that are raised by our staff reducing as well, which is really encouraging. We've also introduced a new leadership development framework, and also an internal coaching academy that I think is helping and supporting our leaders, particularly in that engagement with the staff, and that is driving an improvement, particularly in those leadership feedback from our staff surveys, which I think is really encouraging. So if you like, we've got three key priorities, one of which is around performance, one of which is around our culture and our leadership, and then one around partnership. And the partnership elements of this have been focusing on how we're working with other partners through the development of an unscheduled care coordination hub. And the benefits of having that is by placing a multidisciplinary team together in a room, being able to advise us on what the best thing that we can do for patients. So that is a range of different partners that are coming together to be able to advise crew members, but also to look at those patients that are, those calls that we're receiving and looking to see whether we can prevent the dispatch of an ambulance going out to a patient, because we can advise the patient in a very different way. And as I say, that has contributed to us being able to increase the number of patients that we're able to give as a hear and treat disposition. So they call us and we're able to advise them over the telephone. So those are the key things that I wanted to raise today, but I know that the report covers some other areas. I'm very happy to open that up to any questions.
Thank you very much. So I'll ask a few questions and then I'll open it up to committee. So my first question would be, how are you measuring the improvements?
In terms of our response times, we record and report on that on a monthly basis through our trust board, and we can demonstrate that we've been able to deliver some very substantial improvements over the last 12 months. To deliver anywhere near even a 5, but nearly 9 minutes across the organisation, as I say, it's been less in this patch, but nevertheless, I think there have been other contributing factors to that, have been driven by an increase in demand. So it's been between 7 and 10% increase in demand in the last 12 months. But despite that increase in demand, we have managed to reduce our waiting times, and we believe that that's through some of the measures that I've outlined today. So that's certainly something that we've been able to measure. In terms of the cultural improvement, our staff surveys, and every year we go through our staff survey. That happens between around October and the end of November, and we're just about to put that into the public domain. We know that that's about to be launched in the next few weeks, and that will give us a clear indication of the extent to which that's improving. And in terms of our partnership, we send out a survey to all of our stakeholders, and they have just recently returned that, and we will be reviewing those results over the next few weeks to consider whether there's further action that we should be taking.
You mentioned there you had a 7 to 10% increase in demand. Why is that? Because there's more preventative things going on, such as you say, the hear and treat, the UCCH. So why, with all of that work, you've still got an increased demand?
So the UCCH is a way of us managing that increase in demand, and the demand that I'm referring to there is the number of people that are calling 999, and that has seen an increase in the last 12 months, and that's multifactorial. That will include some people that are ringing the ambulance service in preference to, say, some of the other services. It could be influenced by their ability to be able to access primary care or indeed some of the other services. I would always encourage, of course, patients to call 111 if it's not for an emergency, and we're working very closely with 111 providers to be able to manage some of those patients that are coming through to us, where we believe the skill sets that they have within that 111 service can manage those patients more effectively. But also some of those patients that are ringing the 111 service, we have around 21% of our demand is a referral from the 111 service.
Your work with partners and stakeholders, there's a lot of work going on at the moment on prevention with the neighbourhood health development. So you're working closely with that to help with this increased demand. And also I noticed the UCCH was only really open daytime hours. Are there thoughts to maybe make that 24 hours a day to also help?
I might bring my colleague Mike in just to talk about the UCCH, but let me just make reference to the work that we are doing with partners. And you know, the ambition to work with our local neighbourhood teams to be able to ensure that the contribution for the ambulance service into those patches, helping to reduce the demand, not only more generally, I think, so that we have fewer people that feel the need that they require a 999 service, but to go further than that and say that even for some of those patients that do, then how can we help those neighbourhood teams to keep those patients in their own homes? The expertise that I believe that we have within the ambulance service is really good at being able to manage some of that risk into the community. Whereas from what we see when patients go into an acute hospital is that they can be, you know, there will be other diagnostic tests that will be undertaken, and for some of those patients they will be admitted in some cases unnecessarily, and certainly as a managing director of an acute hospital I've found that occurring quite regularly, and often that does lead to over-assessment and unnecessarily blocking beds in hospitals. Mike, I didn't know whether you wanted to just answer the question around the UCCH development.
Yeah, sure. So there we go. The Unscheduled Care Coordination Hub. One of the primary benefits, just for reference, is our clinicians on scene, if they use that pathway, they also benefit from understanding where that patient care will go. And if you take someone to the front door of an ED, you don't necessarily know what happens to that patient. And for clinicians on scene, that's a really important learning and education point, because then they can reflect on that and say, well, actually, I used the hub last time, and through mentoring and training, we start to upskill the workforce to understand about alternative pathways. In terms of the actual hub, because it's located quite centrally to Basildon where I work, I spend a lot of time promoting the actual hub, working with the leaders in the hub and also the ICB. We monitor our front door admissions. Yeah. So what we want to do is try and break down some of the myths that we get with stakeholders over what's coming through the front door and why have we not tried to use alternative pathways. So we've just completed, in the last 8 months, 5,000 front door audits, which is a kind of a unique, it was a trial, but now it's a permanent audit process. And that's helped us adjust how we look at care home front door admissions. So we share that data with our ICB colleagues and stakeholders. And that's the same for HCP referrals, which Neil mentioned about the 21% that goes forward. And also we're looking at frailty admissions as well now. So what do we do with those? So we're in constant dialogue using the hubs to get that information back. What are the GPs seeing on the calls? What are our crews seeing? And what else can we do to make those pathways streamlined? Because what we've got to remember is that not every patient needs to go to hospital. If they do go to hospital and there's a better pathway, we're stopping those long stays in hospital and the effects it has on chronic health conditions. So really this is about the focus for the better outcome for the patient. So there's a lot of learning. It's been a good success. Would we like it 24/7? Of course we would, but we have to take it in stages. We also have to look at capacity in the hub. Are we reaching the maximum capacity with consultants? What do we need to do to sort of spread that load as well? So we're in daily and weekly dialogue with obviously update meetings to come up with new ways to integrate our pathways.
Thank you. I'll open it up to committee for questions. Councillor Smith.
Yeah, I've two sort of areas to just ask questions about. Sort of congratulations in terms of getting the number of vehicles that are off the road down from 40% to 20%. But how many vehicles do you actually have in your fleet?
Across the whole organisation, we have 500 vehicles, so that will operate. And sometimes when inevitably we see some of the demand in different areas across the region higher than one other part, we do ensure that those vehicles are deployed right across the region.
Okay, so that's 100 vehicles at any given time. Now, your improved status are off the road. You know, 1 in 5 of your vehicles is not there. Now, we live in a logistics hub in Thurrock. Around us, we have many transport fleets. And I would beg to suggest that if any company that runs fleets of vehicles had that sort of percentage of vehicles off the road all the time, then the transport manager would be sacked. I think it's a colossal, you know, it's just a colossal number of things. What are the reasons why these vehicles are off the road?
A really good question. It's like always, it's multifactorial. We will always expect that will be some of those vehicles that are off the road for, for maintenance, etc. So there is a reasonable expectation that we will have that. But one of the major factors actually was an aging fleet, and these vehicles are running, up to 300,000-400,000 miles, during their lifetime. So, one of the things that we have been doing is replacing those vehicles, a significant proportion of those vehicles over the last 12 months. So we have a plan to replace around 275 of those vehicles over the last, since this time last year, and it's got another 6 months to go, and that will make a big contribution to that.
How will that be funded?
Will we lease those vehicles, and that will be funded through a programme of capital investment over that period, and that's quite a lot to do in a relatively short period of time. One of the things that we will be doing is moving to around about 100 vehicles per year that we're looking to replace.
Yeah, it just still seems a huge number of vehicles to me, and I have to say that, I'm impressed that you got, if you think you got 500 and you had 40% off the road a year ago, but I just think in terms of commercial business management, which is a way that we're told to think about the health service these days, which I don't agree with, but that's the way we're told. As I say, the performance levels of whoever's in charge of your fleet, and I accept these are complex vehicles. They're not, it's not just a van that's delivering groceries. It's a complex, life-saving piece of kit. So it is more complex than an Ocado van or whatever. But yeah, I would hope to see that progression will continue, and that the next time you're in front of whatever format this committee has, that you're able to continue that reduction that you have. Credit to you for bringing in. My second question is, and you did touch upon it in your summary, about the handover times. It seems the handover times at Basildon Hospital are particularly poor. I think it's gone from 2024, when it was 26 minutes and 28 seconds, to last year, the average is now 36 minutes and 37 seconds, which is a 10-minute increase, at a time when we watchdog people are constantly being assured that things are supposed to be getting better and better. So what are the particular problems that make Basildon so problematic?
Some of that clearly will be the increase in demand. And look, the one thing I would say is that I recognise that these are really challenging times for our acute hospitals, right? We have seen quite a substantial increase in demand, and they are looking to cope with that increase. But nevertheless, that level of increase is being really concerning. And in fact, if anything, during February this year, those waiting times have even, much higher than that. We've seen waiting times in excess of an hour during those weeks in February. So, that's a real concern to me, because that indicates that things aren't getting better in the way that we had anticipated that they were, and certainly were aligned with the plans that we'd submitted this year. So we're keen to work with the hospitals, and I'm meeting up with each of the managing directors from the hospitals in this locality to consider how we can improve those waiting times. Through some of the work that we can do together. Mike has already referenced the audit work that we've done to consider whether patients could be managed in a different way in alternative locations, working with other community partners and with primary care. And so we are going to explore that, and that's the work that we can do as an ambulance service. But it also then does mean that there are some other things that we're going to need to look at in those hospitals. And from my experience, that will often be about how you maintain flow, and there will be things that are within the gift of the hospital to do, and then the way in which they're going to need to interact and engage with other partners to ensure that those patients can be then discharged into the community. That is, in the days that have gone by, we have seen the buffer, if you like, being in the A&E department, and we've now seen those A&E departments very full. And so, our ability to be able to offload those patients into those extremely busy A&E departments has proved to be really challenging.
Yeah, I do get that, but I think we can overcomplicate A&E, and absolutely the people who manage A&E at all hospitals have my sympathy, because I've been in there and I've seen the sort of people that, it sounds derogatory, but I've seen the case of the people who've turned up and the things that they're presenting with. We should never be in an A&E unit ever, and that's an education and a communication issue and whatever. But I think you can divide reasonably easily the acute case that you're bringing. I mean, and the fact that you've said that you're doing the filtering, you're doing the assessment, whatever. So basically, every ambulance that's blue lit and goes to Basildon should be banging on the front door as soon as they arrive. I know we've seen, we're not whole big city, and it doesn't work like that. I appreciate that. It is a real world that we live in. Where, as I say, I am concerned that Basildon seems to be a problem. Thurrock's a really strange place in terms of its geographical location. How do you decide where a patient would go in terms of if someone was involved, let's just say a car accident in, I don't know, at West Thurrock, somewhere near Lakeside or whatever, geographically, how is it decided? Because there are hospitals with better attendance times, I'm sure, whether it's in Havering or whether it's even across the bridge at Darren Valley or whatever. Do you have to send them to Basildon as within your map? There they go. Because I'm sure there are people in, if they're in a crash or something in West Thurrock and they can be in Darren and handed over within 45 minutes, they'd much rather do that than go to Basildon and be still in the back of an ambulance 3 hours later.
So in short, it's to the nearest hospital, and we would always do that. There are circumstances in which, if hospitals are experiencing particular pressures, they will then contact us and consider whether there's anything that we can do to manage some of those patients to other hospitals. But where there was a requirement for those patients to ensure, particularly for those critically ill patients, we would ensure that those patients go to the nearest hospital, and we tend not to bypass the nearest hospital for those reasons.
Thank you for those good. I'll just throw one other thing with the Chair's indulgence. We see an increasing amount of air ambulance traffic in Thurrock. I know a lot of them are they're medical emergencies. I think generally tends to be cardiac and other issues like that. Has there been an increase in use of the air ambulance, possibly not just for ferrying patients, but actually for ferrying medical skills into the borough? Because I think that's probably what seems to be most of their work.
Thank you. So I think if we're going to talk about an anecdotal type explanation on it for you, if we're looking at more high acuity patients going to acutes, you will see more responses from air ambulances. Yeah, this is why we are using things like the hubs to make sure the alternative pathways are used for the lower acuity, the less ill patients. And that's really important, because this is what we are seeing at the front door of EDs. We're seeing more time critical patients. And that does involve more traffic going through the HEMS cars, the HEMS ambulances. So that would be my explanation, because once we've filtered out all the reasons why someone should possibly not go to an emergency department, we are left with the core work, which is high trauma. Yeah. So that would be my view on it. We are seeing an increase in high acuity.
Thank you, Councillor Spate. You've raised some really good questions and concerns there. I'll follow back a little bit on what was discussed, if that's okay. So you said you had 500 vehicles, of which now 20% are out of use. How many do you need to operate? So going forward, when you're going to be leasing new vehicles, how many will you be looking at? Will you be decreasing those numbers on the expectation that you won't have as many out of use, or do you actually need the 500?
So invariably that changes throughout the year, but normally about 360 to 380 vehicles on the road is normally what we would experience on a daily basis, and with that we can ensure that we're meeting our waiting times.
Thank you. And again, Councillor Spate's comments on the handover times and A&E demand feed back into the whole taking care away from A&E. So it's obviously vital that you know, you're working well with partners, because that's going to decrease handover times, increase people's attendance at A&E, so it all links round together there.
I mean, that's absolutely right, and I think we're taking that that responsibility very seriously indeed. We know that we have a contribution to make to delivering the best care for patients, and you know, one of the ambitions is not only to ensure that our core service is being delivered with the right response times, but recognising that a core responsibility of the ambulance service increasingly now these days is to navigate patients to the right place first time. And we can only do that by working effectively with partners, both in terms of identifying the right places through the audits that we were just talking about, but also being able to utilise the experience that we have across the region, because we're seeing some really good practice in certain parts of the region that we want to ensure is consistently applied elsewhere. And we know that we've got a really clear role to provide that in developing new and local pathways that perhaps don't exist, but also trying to ensure that those pathways where they ought to be in place and you know, there is resource gaps in those areas, is highlighting that to local partners. Because I'm convinced that many more of those patients that we are conveying into hospital actually don't need to be there, but could be managed out in the community for the sake of the capacity that needs to exist. And we're encouraging our local partners to invest in those services locally.
Thank you. Councillor Chuckwood.
Oh, thanks, Chair. Just looking at this page, right, you're talking about the issues of recruiting responders, and can you tell us more why you're struggling to recruit staff to do the work? Yeah, thank you.
So I think that there are two elements of this service. So it's the staff that we will directly employ, and actually we've been very successful. Actually, when we did have some real challenges with not only recruiting staff but then also retaining those staff over the last few years. And it's fair to say that we've been very successful in our recruitment to the point now where we have all of those vacancies now filled for our substantive posts. But one of the things that has struck me actually in the ambulance service, more so than many of the sectors that I've worked in within the NHS, is that we have quite a significant voluntary part of the organisation, a workforce, if you like, those that are keen to work with us, delivering, if you like, critical care, so that somebody who requires CPR, we could still deploy one of our community first responders, and it's that which we're really encouraging our local partners to consider if anybody is willing to help us and support us in that. We know for those areas that have got a large number of community first responders in their communities, we know that initial response time can be very good, waiting for that ambulance to arrive in some of those areas. So we know that particularly for those patients, for every minute counts in initiating that CPR. So the earliest that we can do that, the better. And if you can help and support us in just asking people if they would be interested in providing that service, then we'd be very keen to hear from them.
Can I come in there briefly?
Yeah.
There we go. Just like to come in on that. So just to put that, how important CFRs are for us. If we have a first responder on scene by themselves, before a double-staffed ambulance arrives, the average time on scene spent is 9 minutes faster, so less time on scene than if an ambulance was dispatched and arrived first. So the CFRs are doing a fantastic job. They're on scene by themselves for a period of time, but it does help reduce that time cycle, which is obviously better for the patient. So.
Just to support it. Do you have issues, right, for your recruitment drive? I mean, looking for the people to fill the gap. Do you have some issues in recruiting people?
That certainly has been the case in the past, but in part because of our retention has improved so much that our turnover rates for frontline staff have reduced down to about 6% now, and that was in the region around 15 to 18% previously. So you can see that there has been a significant effort in not only attracting new staff, but then retaining them. And in fact, across the whole of the NHS, we're now seeing a surplus of ambulance paramedics in that sector. Now, we have been able to recruit all of those newly qualified paramedics from last year, whereas that hasn't been the case with other sectors. And in fact, we've been able to draw on, for example, London Ambulance Service, who did have a surplus.
I don't know if that is the case in Basildon, because there are so many reports about, patients waiting in the ambulance to get a bed. Does it happen in Basildon, in your area? Does it affect your performance? Thank you.
Yeah, I mean, undoubtedly, we do have delays in ambulances, and I can say that particularly for crew members, that's the one thing that they will tell you is the thing that they didn't join the ambulance service to do. You can envisage a circumstance in which a member of staff will spend almost an entire shift, a 12-hour shift, seeing one patient and sitting outside of an A&E department, and that becomes very demoralising, and that's certainly an issue that our staff have reflected back to us is the biggest single factor in making their decision to want to move to a different location. So we're very keen to address those very issues.
Thank you. That's a very good point, Councillor Chukwu, and especially your comment on the 9 minutes faster response time. You've asked for our help, and I think it's one of the recommendations as well. How can we do that? Do you have some campaign materials that you can share with the committee?
Indeed, we do have those campaign materials, and I'm very happy to share that with colleagues.
And another thing I read was that in Thurrock, they struggled with recruiting first responders, but also with, if they did recruit them, with completing the recruitment process. Why is that, do you think?
I think predominantly that is. I mean, there are some people that will be very happy to continue, not only to have received the training that we provide, which is comprehensive, but then the confidence to be able to then respond to some of those patient calls can be an issue for some people, and we just recognise that that despite some of that initial ambition, there will be some people that will fall out of that process.
Thank you. Councillor Assistant.
Thank you. You've sort of covered a couple of things I was going to say. I'd just like to say the low turnover you've got now, that must be a reflection of the improved culture, I would have thought. The community first responders, who do you recruit from? What qualifications would people need if we wanted to put the word out, sort of thing?
Might want to comment on that particular issue, but I mean, generally speaking, it's any member of the public that would be keen to participate, and we will then work with them to train them. I mean, there is a requirement to maintain that training throughout the year, but we will ensure that they receive that. Did you want to add to that, Mike?
Yeah, we work closely with our CFR lead, who is actually one of my prior managers at Basildon, so we've got a very strong relationship in the area. And one of the things that we do to help with the familiarisation of the training is that we put engagement sessions in, so the CFRs will come down through training and or later on to see the new ambulances or the different ambulances, to see where the equipment is. So as much is an engagement with our crews, but it's also when you're on scene and you've got multiple different layouts inside the vehicles, there's that time saving as well. So they get an ongoing education, and they can also ask us questions about any skills and how we work together. So we try not to leave them isolated. We engage, and again, I've just come off a meeting this week with the CFR lead to see what else we can do to help promote new people coming in, but also when they're on the job, so they're not forgotten. What things do they need? What new skills would they be getting? What do our clinicians also need to help support them? Because one of the things with CFRs that everyone needs to sort of understand is that they're going first on scene to some really difficult jobs. So we've got to make sure their welfare is supported as well. So that's the whole sort of culture and welfare change that we build in and this also will reflect on retaining CFRs. And also shift and pattern-wise, if they're sitting around not being allocated jobs to be dispatched to, that can also be disheartening. So we're building in things like C1 and C2 auto dispatch. That's coming quite soon. So that takes away the responsibility of someone having to sit there and go, oh, I've got a CFR. So there's lots of really good system processes going on that will help support that particular team, which is obviously very valuable. Thank you.
Thank you. Councillor.
Thank you, Chair. I was going to follow up with the recruitment in Thurrock. You said you struggle to recruit CFRs in Thurrock. Is there any way you can encourage people to build that confidence to finish up the recruitment process instead of them dropping off?
I mean, I think it's a really good question. I mean, and we do inevitably have some people that will, I think, believe that the responsibility of being a CFR is very different to how that is in reality, and I think we recognise that there will always be that. But the key to that is training, isn't it? It's about giving people the confidence to be able to do that, and as Mike has referenced, is then particularly once they've been to some difficult courses, because some of those courses are very traumatic by the nature of it. Is then ensuring that the very strong well-being offer that we provide in the organisation is extended to our volunteers as well, which is something that we do.
Sorry, can I just follow up? Do you have like feedback from the applicants, what they feel like, you think they need, that's what they need, or any incentive that can help them?
Sorry, that was a really good point, and I should have raised that. But yes, indeed, we have, Mike has already referenced the really good contact that we have with our volunteers. We see this as a really important contribution that they can make to our patients, and so therefore it's really important that we're engaging with them and supporting them and getting that feedback on a regular basis.
Thank you. Kim.
Thank you, Chair. I sit here with more than one hat on. I'm not just HealthWatch. So it was really an offer. CVS have a volunteer coordinator who's full-time and pushes out volunteer opportunities. So more than happy to link her in with you because that is across Thurrock, so the volunteer centre is a really good opportunity. And if I may, Chair, another part of it, probably a lot of people don't realise that some of the work that goes on in the background. So I oversee the health and social care projects within Thurrock CVS, so not only HealthWatch, we also do the By Your Side Home from Hospital project. So we ran that for 8 years and that we're still running that, and that's to support people out of hospital like key safes and everything they need, waiting for equipment, moving stuff for a bed, all of that. And about a year ago, we identified the amount of people that were coming back out time and time and time and time again that they'd seen. So we're running a pilot. We were funded for a pilot to do to sort of admission avoidance. And the girls are actually working over in Phoenix House with the paramedics over there. And they really do identify people now where they know they can call them and they will go around if there's no clinical need, and that is to support people to stay at home rather than go in. It's not a care, it's not hands-on care. It is just being there and making sure they have everything they need, because sometimes people go back in because they'll call an ambulance because they're lonely and suddenly it's cold indoors and it was warm in the hospital. It's those people. And one person they're supporting had been in 18 times in less than 6 months, who just turned back round again from A&E. So for us in the community, we have a really, really good service. And since September, we have prevented 256 people from being admitted. And that is via the hub and other services. So just so you know, Thurrock's got a really good one-off. Other areas want us, they come. No, not yet.
I'm going to come in on that. So thank you very much. This is a very good, clear example of how the hub and the partners are working. As from Neil's background, obviously we'd have failed discharges from the hospital. So the fact that we are looking, and we've got clear examples here with partners of the good work and what pathways we are using. That's just fantastic, because that is a key point. As soon as we get patients out, we've got to make sure actually they are fit and safe and secure to be back at home. So thank you for that. That's really helpful.
Thank you. Yeah, thank you for highlighting that, Kim. That really does, you know, I know you do excellent work, and obviously it all contributes, and a big contribution, 256 people. That's really good. Thank you. Councillor Spate.
Thank you, Chair. I did have a question that I was going to add on, but I thought I'd give everybody else a chance. But before I get to that, I think it would be the right time and proper to actually pay tribute here to the work of the first responders across Thurrock. We have some tremendous people, amazing people. Chafford 100 has got a great team across East Thurrock, and I know quite a few of them personally, Corringham, Stamford, East Tilbury and Tilbury. The first responders there do an amazing job, and particularly in East Tilbury, where, as we all know, is a place that can get isolated very quickly by too many trains, and knowing that you've got first responders the other side of the railway tracks is tremendously helpful. The question I do want to ask, though, is evolves around the private sector engaging in ambulance services. Obviously, I think Medicare, EMS, I think, is one of the big ones around here. What amount of work are we actually putting into the private sector? Because I think most people think of an ambulance service, it's an NHS state service, it's all run by the state and whatever. But actually, we've got commercial people operating within that sector. I'm sure Donald Trump would love that, but I'm not sure that a majority of ordinary British people want to see our health services commercial. How much do we rely on the commercial sector in terms of ambulance services?
So invariably that does vary, and typically throughout the winter period we do call on some of those services to help, and that's part of our response to managing the demand. I mean, our demand has increased quite substantially year on year by 10%, but we normally expect to see during the winter period, between 5 and 10% increase during, particularly around the December and January period. And we've observed that this year. It has increased inevitably. And so, we do a range of things, which include offering overtime to our staff, ensuring that we're able to provide lots of other opportunities and incentives to put on extra resources. But that has a limit, and so being able to flex that up and utilise some of those resources out in the private sector, I think, is something that we use as an opportunity to give us that necessary capacity, which we couldn't easily be able to do internally. I will say this, and this is certainly something that we've discussed as a board, is that we want to reduce our reliance on those private ambulance services, but that will take some time to do that, I think it's fair to say. And certainly not only being able to recruit the additional staff that we talked about, for which there is additional funding that is becoming available, but then also the additional vehicles that we need to place those members of staff on.
Could I just ask two quickly things? I'm sure you'll be able to. Would it be fair to say that it's a long-term aim to actually become self-sufficient? Because we keep seeing, for whatever political view, government ministers talking about pumping all the billions into the health service. Well, that should obviate the need to go to the commercial sector. But when you do go to the commercial sector, how cost-effective is it?
It can be very cost-effective for a short period of time. So, these organisations will often provide the vehicles and also staff that perhaps there won't be any additional costs that we would perhaps get within the NHS. So, things like pension contributions is a good example of that. Okay. But that's not sustainable. And actually, one of the things that we want to do is to ensure that we've got a trained workforce that really understands all of the policies and the local pathways, etc. And actually, if you look at the longer term benefits of investing in our staff and ensuring that we gain that balance across all of the patients that we're serving, we believe that that is preferential. So that desire to reduce the reliance on those private ambulance services, I think, is the ambition in the future. Notwithstanding, there may be a small element of that to create some extra capacity during the winter period, I think, is something that we'll be looking for.
Are the people who work in the private sector ambulance services better paid than those who work within the NHS, or is it comparatively equal?
There is a reasonable comparison. I think there may be some incentives in there, but they're reasonably comparable.
Thank you, everyone. So there are 2 recommendations that we've got. I don't know if anyone has any particular suggestions for amendments or additions. The first one is councillors are recommended to note the contents of the report, in particular the progress made in improving ambulance response times and the steps being taken to improve the performance of the ambulance service even further. I'd perhaps add in there about the handover times, because that's equally as important. And also to have something back, you know, so we can see a report, a tangible update on those measures. Has anyone else got anything they would like to add in that recommendation? Councillor Spate. Yeah.
Yeah, I think actually it might be useful in terms of recognition if maybe within the encompass of 1.2, where we actually just pay a little tribute to those that work on a voluntary basis for the sector, but also recognise that those skills that they gain could perhaps be welcomed. I'm trying to think of a form of words to get it together, but pay tribute to the volunteers, but also say, have you thought about joining the team on a full-time basis, because your skills and your enthusiasm and your passion and your life-saving ability would be very welcome. I'll leave you to sort that one out, Liz.
Thank you. So for the first recommendation, is everyone happy with my suggested amendment to that one? Lovely. So we'll go to the second one now. Councillors, I started off with say councillors would like to pay tribute to all first responders for their hard work to date, and we recommend their service and importance. And then it says to liaise with the ambulance service on ways in which they can use their local contacts and networks to promote the various volunteering opportunities at East EAST for local residents. So with that, I think if we can add in that you'll also communicate with us with sort of campaign materials and help us with how we can recruit people and have a bit more about what's needed and everything as well. So if we can do that. Also, Kim, did you mention that there's some work that Health Watch can do with regards to...
We can do, but CVS have a volunteer service, volunteering, so recruiting volunteers and giving out information about what's available. So
we could also include that to work alongside CVS as well on this with the recruitment as well. Thank you. Okay, so are all councillors in agreement with those recommendations? Lovely, thank you. Well, thank you both very much for coming tonight, and we look forward to seeing further progress on your hard work. Thank you. Thank you. Lovely. Okay. So I will now move to agenda item 6, which is preparing for adulthood, which is on pages 33 to 42 of the agenda. So this is coming to us really as a review of the processes today ahead of the new strategy. We did send out the current strategy to members. So it's really going to look at the best practice, the best way forward for young people in this transition period, especially with the increasing demand we're facing. So may I ask Bosa to present the report, please? Or to present it.
Yeah, so Chair, can I quickly introduce the report, and then Bosa, as our Principal Social Worker, is here with me to add anything that I miss and to take any questions you may have. Can I just say as an introduction, I am very conscious this report is coming very early with very limited information for a scrutiny committee. That was intentional. So where we're at is this is the start of the process. The importance of ensuring that we optimise the outcomes for young people that go through the Preparing for Adulthood service is, to me, so important that what we want to do is, rather than do the whole piece of work and then come to scrutiny for you to comment upon those findings, we wanted to check with scrutiny at the beginning of the process so that you can actually feed into saying, yeah, you think the steer that we're seeking your steer and support for the direction we're proposing to take over the next 6 months or so in undertaking this piece of work. I do want to stress the current Preparing for Adulthood service, which sits within adults but works closely with children and with other service areas, is not failing. So if you look at the CQC inspection report from last August and you look at the more recent SEND inspection that's been undertaken in children's services, the services are seen as being reasonably good. However, on the national level, some of the national feedback we are getting around some of the key findings from the inspections are that preparing for adulthood is one of the core areas where services are not reaching the outcomes that we would really like to see. And our view in Thurrock is that we could do better and we could make an improved service offer. Now then, as the Chair has indicated, the Preparing for Adulthood strategy, which was only circulated very late yesterday, I do apologise, was timed out at the back end of 2025, so it's just recently timed out. So it seemed ideal at this stage, when we're looking to review the service offer, to also add that part of that process, to look at our current performance, which is within the report, to actually say we can undertake a review of the strategy, a refresh of the strategy, at the same time reviewing the service offer and how we want to make sure that we can take this forward to optimise the outcomes for the young people at such a critical stage in their kind of life chances. So to that extent, Bosa is here to add any other comments I've missed, or to answer any of your questions if I can't manage them. But I just want to reinforce the recommendations. This isn't just about noting something. This is about asking for your support and your steer. So the recommendations are outlined at the top of page 34 in 2.2, 2.3 and 2.4 around noting the performance of the current arrangements, and we welcome your comments on the issues identified. To sort for your support for a comprehensive review of the current Preparing for Adulthood arrangements, as outlined in the Statement of Intent. There's a Statement of Intent which has been drafted, not fully signed by all the parties, but is supported by all the parties. So we're just in the process of seeking all those other signatures on the piece of paper, but I wanted to circulate that anyway, which is really promoting a whole life, whole family, whole community approach to this, where we try and break down some of the traditional cliff edges is what you'll hear some people refer to, and the argument is there shouldn't be such a thing as a cliff edge because they're made by us, and actually we should be kind of making sure we've got more seamless service. And the third one is just seeking your wish as to whether, when we have got something to report, you would like to see that come back, obviously, before we would then take you through the formal cabinet process. So, Bosa, unless I've missed anything you want to add, I'll leave it there. But Bosa, over to you.
Yeah, thank you, Rob. Good evening, everyone. Like Rob said, my name is Bosa Sunday. I'm the Principal Social Worker and Head of Social Work Support in Adult Social Care. One of the services that I oversee is the Transition Team, which is the Preparing for Adulthood team. I think Rob has actually captured most of the things that we are looking at. Like he has already said, we've had our recent CQC report shows that our transition work in Thurrock is very positive and is strength-based. And also the recent SEND inspection as well was another positive one. I think what we want to be able to do, I mean, looking at the national research that's been carried out, we in Thurrock, we believe in continuous professional development and also ensuring that we are improving on the services that we provide, especially for our young people that are transitioning from children to adult services. We want to make sure that they are transitioning safely. And also what we want to be able to do is to actually design an offer, not a service. So it will be in order to meet the young person's desired outcomes. Like Robert already said, we've got a Preparing for Adulthood strategy, which was actually co-produced with people with lived experience, and it was led by the user-led organization. That was from 2020 to 2025. And at the moment, the user-led organization is actually doing more consultation with people with lived experience, young people and families, to ensure that we refresh the current strategy and the voice of the young people reflects on the strategy. And also, our practice actually reflects the 4 PFA outcomes, which is a national outcomes, and it was actually funded by the Department for Education, which was concluded in 2022, in order to ensure that the services that we are providing actually meet the holistic outcomes and needs of the young people. So we look at the young people's
outcomes like independent living, employment and careers, health and well-being, and community inclusion. Because when young people, when they turn 18, it doesn't, their needs doesn't change, their vulnerability doesn't change, their disability doesn't change. There is changes in legislations. So what we want to do is to make sure that when young people are transitioning from children to adult services, it actually meets their desired outcomes and they are transitioning safely. We do a lot of work with stakeholders, our children with disabilities team, or children's services, health, which is very important, play a very major role, and also the user-led organization, youth offenders team, just to make sure that even those young people that doesn't fit into any of our boxes, we are still able to support them to be able to live the life they want to live when they become adults. I think Rob, you've already mentioned the recommendations that we are looking. What we want to do is to make sure that we review our current approach to make sure that working with young people, we are able to meet the desired outcomes, and also we are safely transitioning them, because transitional safeguarding is everybody's business, and it's actually a national concern. Looking at the researches across, we can see that some young people, when they turn 18, they fall off the cliff edge, and those are the kind of things that we are avoiding to be able to support them effectively. So please, there's any question?
Thank you very much, Robin Bosa, for introducing that. So yes, it's clearly very important. It's also a very individual pathway, isn't it? So it's not going to be one size fits all. I noticed on the strategy before you had a strategy group and task group being formed. Is that still ongoing? So that's that same group involved in the... It's still involved going forward. Lovely.
It does help because it holds partners accountable. So we meet every quarter to review the actions in the Preparing for Adulthood strategy.
Thank you. And I think it's noted that there's quite an increase in demand at the moment. Do you have the capacity and resource to meet this demand?
I think it's somewhere on the report here. I mean, just like nationally in Thurrock, we're still under pressure because of the increase in demand and the complexity of cases that are coming through as well. And so we've got a Preparing for Adulthood team, which is made up of a team manager, 2 senior practitioners, 3 social workers, and 2 assistant social workers. In as much as the cases, there's increase in demand, we're still able to support those referrals that are coming through. So we don't actually have an issue with timeliness, but there are some times that we've had to prioritize those cases. So I've just put, as of this month, we've got over 170 young people that are open to the team. And also, we've got 2 young people that are waiting assessments. Now we've got 15 reviews that are overdue. They will have 3 referrals that we are screening. So we try to monitor those cases that are coming through just to ensure that we're not leaving anyone in danger, they're transitioning safely. Yeah.
Rob, did you want to comment?
And can I just add one comment to that? And can I just stress a point that Bosa made, but it's absolutely critical to this. So Bosa said, what we want to do is we want to try and design an offer, not a service. Yeah, and so I think really the challenge for us is to look at what the best offer could be, and then my job, a challenge we will then have is making sure we can design a service within the capacity that we've got that optimizes that offer for people. So I think the truest way to do this is to do the piece of work around the offer and then look at what our resources are and see how best we can design a service to deliver that offer. So I'd just ask for it to be considered in that phased approach.
Thank you. And one of the key things you're doing is looking at an earlier age, from young people from age 14. There are obviously delays in EHCPs. How will that affect trying to pick up these young people and start the transition process earlier?
Obviously, the schools lead on the education healthcare planning reviews. And like you already said, we attend the school review from age 14, year 9 in school. And that's when we start giving them information about adult services. We want to find out about the young people, what they want to do when they turn 18, and the desired outcomes we want to meet. So we're still able to meet that. We're still able to, we've assigned different workers to different special needs schools in the area, and we're still going to meet some of the mainstream schools. So we attend the ENR review, and sometimes if the young person is going to, sometimes we don't attend the year 10, only because we've already attended the year 9, they've got all the information and they know how to contact us. But we make every effort to attend year 11 because some of the young people might decide to leave school at year 11, and then we start that's when we start the adult assessment.
Very much. So I'll open it to committee now. Are there any questions from committee members? Councillor Manuel.
It's not a question, Chair, but it's just to say that, you know, we note all the recommendations, or I do, and I'm sure we all do here, and that I welcome this report, even though, as you said, it's in the beginning stages. I used to be on corporate parenting committees, one of the first committees I was on, and that was always a big worry, like for me, like as a young person myself, for young people that have been in care. For them, the needs don't necessarily change. Something that you said was so true. It's like their needs doesn't change, just the age does, and then legislation obviously that reflects that. But at the same time, they're still going to need support from people, and that whole idea of the cliff edge and young people not falling off the other side of that, that's really important. So yeah, I welcome this, and I hope to see how it develops as time goes on. But it's a really, really important piece of work, so I just wanted to put that on record. Thank you.
Thank you.
I should probably not say anything, but I can't resist. Sorry, because you've made such an important observation there. So I just wanted to know, we've had initial discussions, both of myself with colleagues in children's services and with others, around that corporate parenting responsibility of the council. So one of the things we want to explore, and it goes back to what I was saying about an offer, not a service. Yeah. So the numbers are in there as to the people that we traditionally work with through this route. But we know if you look at the numbers of children looked after and care leavers, there's somewhere upwards of 500 in Thurrock. Well, I was amazed when I met some of them last summer, because let's be honest, there's a cohort that will fly. Whatever you do, whatever challenge they have, they're just going to be amazing. There's also a group who, whatever support you give, they're going to really struggle, they're going to really challenge, we're going to have to really work intensively. There's a lot of people in the middle who, at these touch points, just growing into adulthood, who could have really independent lives, but they need some support, they need some advice, information around how to get sustainable housing, how do I manage your budget, how do I get job interviews, what training opportunities are there. I'm struggling with accessing health services that wouldn't normally fit into the eligible criteria. But if we had capacity that's dealing with those people with the eligible needs, but they could also be a touch point. It could be in the VCS, who knows? But you know, it could be a touch point to support that wider cohort of people that we have a corporate parenting responsibility. It could get really exciting. So I've probably said a bit too much, but just so you know, that's a conversation we've started because we'd like to explore that as an opportunity through this process. So thank you for your observation.
Thank you. Kim.
Thank you, Chair. I've just put my Health Watch hat back on. We are setting our priorities for next year, and the way we do that is by looking at all of the lived experience that we've gathered, all of the voices, all of the feedback, all of the issues raised or good points raised. And one of the things that has come up in our top 6 has been around transition. And it not only is for children with disabilities or children in care, but it's also been raised that there's a bit of a difference between children that are terminally ill who live on to be an adult and then they pass away as an adult, and the absolute difference in the support that they get in both places. So I met earlier with BOSA to say, we are looking at doing a piece of work that isn't around looking at what's wrong or what's not right, or it's around all the things that are available, because we get different feedback from different people. So somebody's in a children's service or someone's just gone into adult services. So we just want to do a combined piece of work. We work with the coalition because they're now part of CVS, and that is around looking at the whole offer and the feedback on that and getting people's real lived experience to help form the next part of this piece of work. So we will be doing an independent piece of work around this as well to feed in, so real voices.
Yeah, thank you, Kim. Like we said earlier on, we really welcome that with something that we will looking forward to working with you on. And I think this is actually the best time to do it while we are reviewing the current strategy that will form part of it. Thank you.
Thank you, Kim, for highlighting that. Obviously, that's very important, and work for terminally ill children, and also I would imagine some with very complex needs or illnesses where the life expectancy is reduced. I thought, is that something that you're going to be covering as well? Yeah. Thank you.
To add in, I think it's a really, really important point. As Bosa said, we'll fully accept the offer and we welcome the offer. And we'll need to do a project plan for this piece of work, and we'll engage Healthwatch into this whole process. But just the additional bit is to make the links to the health and wellbeing strategy, which is, is being undertaken with under the Start Well, Living Well, Aging Well and a Dying Well section. And I think it's important that we recognise that dying well isn't just about older people, or so we will make sure that that we address this as part of that wider strategy piece as well.
Thank you. Kim, did you want to come back in there? You're okay. Yeah. Thank you. Are there any other? Okay. Thank you.
Thank you, Chair. I just want to point on transition planning and parents and the young people. It's a very big process, and it's a big change for any young person who has sent, moving from children to adult services. So, and the expectations from parents as well can actually make it more an uphill task to actually overcome when they're transitioning. So how do we manage parents' expectations? Because services change from children to adults, like financial assessments, character assessments. How do we manage those parents' expectations? Because they will be thinking, this service is going to stop and I won't be able to get it in adult services. So how do we manage that during those processes so that they are kind of, manage those anxieties that they have around that transition to adult services?
Yeah, thank you, Councillor Alike. That's a very good question. When we're working with young people, when we're supporting them to transition to adult services, at the same time we are helping parents, supporting parents as well, working closely with parents. So it's not just transitioning children to adult services, the same thing with transitioning parents as well. We undertake carers assessment. Is a first option. It's a legal requirement for us to do that with them, to offer them a carers assessment. And apart from that, for those that doesn't want a carers assessment, we will always normally give them advice and information. We will signpost them. And also, there's a lot of work going on there. We work closely with schools. We attend the parents' evening. We have workshops for parents to come and ask questions about transition, because we know, like you said, it's a very daunting process for anyone, for the young person, and also for the parents. They would be anxious because it's something very different. And there's just a lot to take in as well. So there's a lot of workshop that we do with Mo James. She's the sent parents participation. We do a lot of work with her. She do have learner lunch. So we attend to give information. And at the moment, we're in the process of devising a kind of information pack for the young person. So we're doing it along with children's services, education, and health, so that we have all the information in one pack instead of having different information. Children gives their information, adults, health. So we are doing one information pack to give to the parents and the young people. So there's a lot of work going on with parents by attending school reviews, school meetings, and their parents' evening. And when we attend the school reviews sometimes, for parents that are not able to attend, we do contact them to say, please, if you want to talk to us, this is our number, contact us. We can have one-to-one with you outside the schools. So there's a lot of work going on with parents as well as the young people or outside the schools.
With regards to some parents who may refuse service for their young person because of financial assessments, some of them might say they don't want to serve because of the contributions they will make when they transition from children to adults. So how do we make sure that they take on maybe direct payments or, to kind of support that young person when they move from children to adult services?
I mean, obviously, for those that meet the threshold for care and support assessment and for provision, for care provision, we would always encourage them. We offer them direct payments as one of the first options for them to consider. And for those that, like you just said, I mean, parents, we hardly get parents that say they wouldn't want to contribute towards, I mean, the child's package if it's required. And we've got the local area coordination team as well that work closely with young people and parents. So what we've done, we started a pilot for the local area coordinator who works with 16 plus, because I mean, at the moment they're working with 18, but they started working with 16 plus, so that they started prevention work. They will, I mean, inform parents of services. They will encourage them of services to tap into. Some of them might not be commission services, or they might, I mean, it's just having that information there when they need it. Answer your questions.
I think Box has given you a very honest and clear answer on that, but just to muddy it slightly, it's a really good question, but that's one of the points of this review. What we want to do is the cliff edges we talk about are broadly, they're not Thurrock's fault, it's national guidance. It's around how the law changes when you change from child to an adult. It's around the financial arrangements, and that's what we live with. What we want to try and do is look at seeing if there are ways that we can try and smooth that and kind of blend it differently, think through a different process. So maybe we look at how we use our resources here differently, but also how we challenge, maybe potentially challenge nationally, as how you can approach these and how you can support parents to think about the transitioning of their young person to adulthood earlier and make them increase their awareness. Because one of the issues that we come across is that parents don't necessarily understand until quite late in the process, till their child's 17 or something like that, and then suddenly it hits them quite hard. They don't understand all the differences. So if we can work with them from an earlier age, as both indicates we try and do already, then there's a way of just kind of trying to have a more mature and intelligent conversation through the process. But this is a little bit about challenging. With the piece of work we're scoping here has got a bit of a national profile. We've got research in practice. Our really support is in the background on this piece of work, and we're getting quite a lot of support in what we're wanting to try and how we're looking to try to approach it. So I just want to say it's not easy. It's a really good question. I'm not saying we're necessarily going to get all the answers, but we'll try.
That's a Chakru.
Thank you for Chair. You know, transitioning we're talking about is not easy for children transiting from to adults. You know, there are going to be so many other issues. Now, how do you support them in terms of their mental health and social inclusion and some other things? Yeah, because it's never easy. Thank you.
I think, thank you for that. I think I'll probably start by saying that we've got a multi-agency approach. So, and also, also the transition team, the social workers, the support planners, we have the trained to work with young people with special needs. They've got a very good understanding of the Children and Family Act and also the Care Act 2040 and the SEND guidance. So when we have a young person that's got mental health issues, we've got the specialists to be able to support them and at the same time refer them to the appropriate service to meet their particular needs. So we've got a team that is a specialist team that works closely with them. So that's why we've got a designated team that does that under the umbrella of adult social care.
Oh, that's good. You know, people in care, some of them are from, let me say, ethnic minority, yeah? And blending into the system is quite different. It's a bit hard for them. What kind of support do you give them, you know, to integrate into the community, into the British kind of lifestyle? What kind of support do you give them, right?
Yeah. So, like I said, our social workers and support planners, they are skills to work with people from different background, ethnic background. And also, we've got the advocacy service as well that will support them for their voice to be heard. One other thing that we have in Thurrock is that we've got the micro-enterprise, whereby we have different providers in there that will be able to support people with mental health issues or they're from different background. I'll give you an example. We've got a care home, and we place someone there from an ethnic background, and they've got staff that will be able to support that individual or prepare which is very important, the food that they would like to eat. So we've got our provider are from diverse group, so they'll be able to manage any care needs, maybe cultural needs that the person has, or the young person has.
Thank you. Councillor.
Yes, thank you. I come with no surprise that, you know, I think Rob knows I've been really concerned about the joined-up functionality between very young people and then the transition to young adulthood and then into the teenage years. And I think we need to be an awful lot better at it than we currently are. So I do welcome the work that's in its infancy and what you're doing, and also the recognition of the lack of joined-up commissioning, for example, which I think is really important. You also touch on, in your report, the 34% increase in young people 16 to 25 with EHCP attached to them. I appreciate this is in its infancy. The news is very much in its infancy in terms of the government's plans, how they want to change the EHCP system. Have you any initial thoughts on how that possibly could affect your plans? Because I know I've spoken to 2 or 3 people in local schools in the wake of the announcement, I think it was earlier this week, about EHCP, and they're very, very worried about the impact it's going to have on them.
Yeah, thanks. Good question. I'm afraid I don't really have a particularly good answer for it, Councillor Spate, but what I would say is that we are meeting, and we've got our next meeting, I think next week, with Children's Service colleagues, with Tendai, Michelle and Elise, and I'm going to meet up with a number of the other staff in Children's Services. So we are doing a joint working approach to this piece of work within the services, including housing services as well. So their intelligence, their expertise will help be able to inform exactly how we need to address that. So it's a really good challenge that we've got, but I don't have a direct answer for you.
No, thank you. It was probably a very unfair thing to throw at you, especially as it's all so recent. But I think that's the key, and that's what we're here for, is to flag these things up, to make sure that we are proactive rather than being reactive in 2 years down the line thinking, oh, hang on a minute, the environment has changed, the scenario is completely different to what it was when we talked 2 years ago. So I really welcome the fact that you're engaging with other directorates and you're on the money, so well done. Thank you.
What I will do is it's been recorded. I'll give a shout out to our children's colleagues and say that, was it 2 weeks ago, they did an event at Orsett Hall around the Family First Partnership, which was excellent. Had really good attendance from across the council, not just Adults and Health, but Place Directorate and a range of other really interested parties. And it was a really good event. And it really hit me like an absolute train, just how much we could do better together. We do a lot more. We do some really good stuff, but we could really improve across the piece, and this is a component within that. So I totally agree.
Thank you for that, Councillor Spate, and we can add that into the recommendations to maybe get an update on the changes to the HCPs. I think that would be useful for the committee to know. Thank you. I've got Councillor Sisterson, please.
Thank you. Yeah, it's not really, again, not really a question, but just from a corporate parenting perspective, from that committee, they really do seem to do excellent work supporting the children as they come out of care and as right up to the age of 25. And probably beyond this, they'll still have the context there, you know. So, yeah, just to say that it's good to hear that you're, you know, working closely with them, and I'm sure they, you know, there'll be a lot of examples that can be taken from them that will be helpful. Thank you.
So I can't miss the opportunity to just say one thing on it. So the challenge we were given, which is really interesting, an exercise to go home and do, and it's about really, you know, being really flexible over the age of definition of age. So a challenge is go home and ask any of your loved ones or anything else, when do they remember being an adult? And the person that does this question, these events, she's fascinating. She's done to over 3,000 people now. She swears blind. Not once has she ever had the answer at midnight on my 18th birthday. Yeah, and I think it's that kind of thinking which we need to bring into it. So just kind of recognising our responsibility around the corporate parenting, that's the approach we want to try and bring into this. Okay.
Are there any other questions or comments from committee? Okay. Well, thank you very much for that. It's been very useful. I think we have got some recommendations. I think if we add in Councillor Spate's comments on the HCPs, there's also been quite a lot of discussion around corporate parenting role. So I don't know if we can acknowledge that in one section. Maybe we've got the note the performance of current arrangements and comments upon the issues identified, acknowledging also the increasing demand and potential to achieve better outcomes for young people at this crucial stage in their life, and recognise the involvement, you know, corporate parenting, children's services, and as well, if we can add that in there. Would anyone else have anything they would like to add in at all? No, thank you. And also Kim's mention of the work that they're doing with terminally ill children or children with reduced life expectancies. I think that would be quite useful to get updates on the work that's going on with there, and linking in with the health and wellbeing strategy as well. Lovely. Thank you. So is everyone in agreement with those recommendations? Lovely. Well, thank you both very much. Thank you. Okay. So we'll now move on to item 7. This is the Thurrock Autism and Neurodivergence Conversation, which is pages 43 to 68. Many of the committee will be aware of the work that Kerry and Ian are doing from the informal meetings that we've held with people with lived experience and parents of children with autism. So it's an ongoing strategy. It's been going for a long time. They've worked very hard, lots of workshops, meetings, stakeholder involvement, engagements with those with lived experience as well. So they're bringing tonight the work that they've done to date for committee to view and ask any questions on. So I don't know if one or both of you would like to present the report. It's Ian, is it? Okay, thanks.
Good evening all. Just to sort of set the scene, the National Strategy for Autistic Children, Young People and Adults is clear about the responsibility of all local authorities to have an autism strategy. Thurrock's had an autism strategy for quite some time, but senior management team in adult social care decided it was about time we did a review and refresh. But not just a review and refresh, and maybe doing strategy in a traditional way, really embracing the concept of co-production and co-design to do this in a way that we feel if we do it properly, we'll only have to do it once. This is why we use the language of conversation strategy, because we see this as an ongoing conversation with the autistic and neurodivergent community of Thurrock. So the purpose of the report and the accompanying presentation in your packs was to really just try and explain the approach to the strategic work and the engagement we're doing, and seek your views and opinions and any recommendations in readiness for us to pull together a full report, finalise the strategy, the implementation and action plan based on all the work we've done and the recommendations that we have got from the autistic and neurodivergent community of Thurrock, in readiness to come back to health and overview and scrutiny in the new municipal year, and then beyond into cabinet in the new municipal year. Just to give you, I'll say the information's in the report, but once we made the decision to review and refresh, then we engaged with the Thurrock Coalition. People will know who the Thurrock Coalition is, but it's an organisation made up of a number of third sector organisations that Adult Social Care contract with as our user-led organisation, and they went out and did a significant piece of work with the autistic neurodivergent community of Thurrock across a range of methodologies, one-to-ones, surveys, email dialogue, and a significant amount of workshops, and that included people with lived experience, those with experts by experience, those with parental lived experience, and key professional stakeholders. That led to the initial report, which identified a number of recommendations that were then rationalised. There was quite a lot of overlap, and in fact, some of what was in that report weren't recommendations, they were more statements. So the Coalition presented to the Adult Social Care Senior Management Team a report in April of last year with a significant amount of recommendations. We took those recommendations forward and started working with an organisation called Working Together for Change to try prioritise those recommendations because there's quite a lot to do. And that was across a range of areas. Although adult social care sponsor effectively this strategy, it covers children's education, mental health, health services, including the diagnostic pathway, employment, housing, criminal and youth justice. So there's 8 key areas that this strategy is trying to address. The recommendations were given to us in April. We then developed a steering group with predominantly people with experts by experience and some people with parental lived experience and professional stakeholders in and around the world of autism. That led to workshops in November where we had quite a big turnout. It'll be in your presentation. You might be able to see some photos of the people that turned up. I think we had over 134 people. And we embarked upon an exercise of prioritising and voting. The people gathered voted for which recommendations we should prioritise and take forward first. That led to 20 clear recommendations being identified at the end of November. We had further workshops in January and February to try and start to action plan those workshops. And now that leaves us with the next stages, which is in the presentation. The next steps are for us to finalise those strategic areas of focus, to formulate a strategic implementation plan, agree and develop our governance arrangements, because our view is if this is going to work as an ongoing iterative conversation with the community, we need to maintain and continue to develop trust with that community, which has traditionally been quite difficult. If that's the case, we want people with lived experience and experts by experience to be at the heart of those governance arrangements. They are not certain. Our view is co-production, good co-production, won't be certain. If it is certain, it's not really good co-production. It's quite complex, it's quite difficult. And the community, the autistic neurodivergent community we're working with, obviously our experts by experience have their own lives to lead. They might have processing requirements in terms of managing the ideas and plans going forward. We want to think about and develop and seek agreement on expert by experience remuneration. I think that's something we need to think about quite carefully. If we're going to ask people to co-produce and give their time, should we ask them to give freely of their time, or should we ask them to give their time with some remuneration attached? The plan would be then we would look to form, in that governance arrangement, look to form a co-production board led by, the majority would be those people with who would be experts by experience or lived experience, would form the majority of that co-production board. And as yet, we're still unpicking and trying to put together what those arrangements will look like. Our steering group met yesterday. We're meeting again next Friday. It's a work in progress. As Councillor Rigby said, we have been to informal overview and scrutiny in November last year and again in February this year. We just wanted to bring it here so you understand what we're doing, you know, and look for any sort of advice and guidance or any recommendations you think, or things you might have noticed from the report we may have missed, etc. As I said at the end, the co-production process and timescales will always have to be flexible because we're working with people who are not paid professionals. They're people who are, you know, mums and dads and people who are trying to go to work and they're giving their time. But, you know, we're very close to being ready to pull together our strategy, our report and our implementation plan. And as I say, we'd like to bring that back to this committee and full cabinet in the next municipal year.
Thank you very much, Ian, and thank you both and all your colleagues and everyone with all their work so far. So obviously very pleased to see what you've got tonight. There's been a lot of engagement. Are you confident you've reached a wide demographic area, including hard to reach? And have you done any online engagement for those that maybe physically can't attend meetings as well?
Yes is the answer. We've done some online workshops. We've reached out online. We've reached out using social media as well. I say we have. I mean, our experts by experience. One of them is in the gallery. have done a lot of work to reach out to the community, as have the Coalition. We do recognise there's work to be done in some of the seldom heard voices. So we've reached out to the sensory impairment community. We've had some engagement, but not as much as we would like. We've had some engagement with the traveller community, but once again, we need to work upon that. As I say, this is an ongoing iterative work in progress, although the strategy will reflect the fact that it's a learning experience. As we go, we'll learn. Hopefully, we'll deliver on recommendations. New recommendations will emerge. But yeah, we're very conscious of trying to make sure we reach out to those seldom heard voices. And the last workshops we did evening workshops, we did daytime workshops, we did online, we did in person. But we know there's lots more people out there we want to try and reach, and that remains an ongoing piece of work.
So I was just going to add, one of the best ways of reaching people are through the connections that people with lived experience have themselves. And we've definitely got a number of people come forward through the work of people like, say, Jo, who kind of will hide her kind of like under a bushel really, but she's kind of been, front and centre of a lot of the work we're doing and kind of encouraging people who have maybe lost trust in the past to come forward and be part of this work. And I think that's how it's grown as well. And that's where, Ian was saying actually it's really important for us now to keep the trust of the community because they've given so much of their time and to actually make sure that we drive things forward and that they recognise that in the experience that they have. But I just wanted to say a big thank you really to kind of those people that have given their time because they have given a considerable amount of time. And as Ian said, we're paid to do this, but they are actually giving their time freely because they just want to make things better and impart their experience in that process.
Yes, thank you, and recognise all the hard work of the volunteers that are giving their time. I don't wish to dwell too much on this, but you did mention remuneration. I know with any sort of research and participant, it's quite a sort of debatable topic as to whether you remunerate or not with ethical concerns. So will you be consulting some ethical advice on that area if you are considering entering it?
Yeah, I mean, I think we're looking at a co-production approach, which includes looking at remuneration. A number of local authorities have been thinking about it, so we have got some collar policies and some guidance to have a look at. And it's not always, when we say remuneration, it's not always about paying people to attend. It's sometimes, and I'm not just talking about autism and neurodivergence community, but it can be things like providing a sitting service or arranging for someone to have a child looked after so they can come out, or making sure that kind of there's kind of a meal that we can give someone because they might have come straight from work. So I think it's a wide variety of things that we can provide, but I think at the moment we haven't really got an approach. And I think we really need to go out again to the community and find out what that looks like, and work with people like him, etc. as well, who are probably kind of far more advanced than we are in kind of having that approach developed. But I think it's really important to do because we talk about co-production an awful lot, which is absolutely right, and it's right for people to be at the centre of what we do, but actually we do need to say, well, how do we do that to actually make sure that we are not just utilising your time without actually kind of recognising what you're maybe giving in order to do that, and how do we do that for you to enable you to kind of to keep giving your time.
No, I think that's a really good idea, and it will also, going on from Ian's comments, it may well help to widen who can come for those that can't even give up time to do an online discussion as well. So I think that's definitely, I think that would be very useful, to research. Thank you. Right, I will open it up to committee. Are there any questions? Councillor Spade.
Thank you, Chair. I don't really have any questions. It's just, if you like, it's a commentary. One of the joys of being on this committee and its predecessor over the years that I've been on the council has been to see proactive work. Initially, obviously, was under Rob's predecessor, Ian, and his team, and that team's continued under Rob's direction. And I think this is a really great piece of work to be undertaken, and it shows how Thurrock has, there's a lot of bleak things that happen in Thurrock, and there's a lot of things that we can rightly moan about, but there's also a lot of things that we can be proud about, and I would say, thank you for your work and John's work on this. I would also have an apology. I know we've had a number of briefings on this as you've been getting to this evening. I haven't really engaged because there's only so many strings on a bow you can play as this game. But I think this is really impressive and will bear fruit, and it is proper engagement with communities who matter. I have a vested interest in this in a way. I've spent a lot of time over the years I've been in Thurrock engaging with people at treetops from the very youngest through to their post-16, which does some amazing work. And also my own son works in education and deals with autistic children, so I get firsthand how hard it can be. So anything that we can do to help those young people graduate through to adulthood, but also their families, is just hugely impressive, hugely important. And all I will just say is my thanks for the work that you're doing, my commendation, and I look forward to hopefully whoever is running this administration next year embraces the work that you've done, doesn't push it under a counter and says this is what makes Thurrock good. Is the sort of work that you do, and I love the fact that you're talking about the pending work that you're doing, and you described it perfectly, the seldom heard voices who will come to us as councillors sometimes afterwards and say, oh, nobody ever spoke to me. Well, you're going out and looking for them, and I just say, as I say, I think it's a really, really good thing, so thank you.
Thank you, Councillor Smith. Thank you. Councillor Lee.
Thank you, Chair. I just want to say thank you because I was attended one of the sessions with parents and people with lived experience, and it was just very good to to hear their experiences, to involve them in the work and the co-production of the whole strategy. So I'm really impressed with the work you're doing and involving everyone. It was a very diverse group with people from different ethnic background and socioeconomic background as well. So I'm just looking forward to looking at the recommendations and how we will carry that out, because there was a lot of things that were explored that night, so it was too much to take in, So I appreciate the work that has gone into this and all the people that have volunteered their time and their effort to have different kinds of engagement in different communities to actually bring the work to life. So just looking at towards the recommendation on how we can actually help to make sure that, it involves everyone to make it successful.
Thank you. Would anyone else like to say anything? No? Councillor Benson, you came to both informal meetings, which was very good. Would you like to say anything on your experience at the informal
only
meetings?
the fact that, with neurodivergence and everything, we've seen the numbers just get bigger and bigger and bigger. Do you think that it's possible to meet the aspirations of everybody? Because at this moment in time, it's such a huge thing that you're trying to achieve. And every parent's child, every person, it's such a wide range. To try to meet everybody's aspiration, everyone's going to have different things. And I just think it's with the barriers that could be put in front in years to come to achieve everybody's aspirations.
Yeah, I mean, that's a huge challenge, and you're quite right, Councillor Benson. It's a huge national challenge, which is, is writ large in the national strategy about one of the first things we've got to do is try and change societal attitudes to autistic and neurodivergent people. And I think you do that one block at a time almost. So that's why it's important, recommendations that although we haven't been to cabinet, we're progressing recommendations, for instance, trying to get autistic neurodivergent people on the planning committees for future builds. That starts to change the culture. That starts to change some of those challenges that people face. So we had tenancy support officers that came to our workshops. We're often, dealing with what could be neighbour disputes without any understanding that there could be autistic neurodivergent people living in the wrong type of accommodation. So, yeah, it is a massive challenge. But our view is we just keep building on that one block at a time. we're already having success. We've got 20 recommendations. We've already, since the last workshops in February, we've already started to have really solid progress on 5 recommendations already in and around training custody staff in our police stations, in and around training our job centre staff in Oliver McGowan Tier 1, Tier 2, the understanding and awareness of autism training. Yeah, we've all started conversation with our Thurrock Council's HR department about how can Thurrock Council become a role model for the employment of autistic and neurodivergent people across Thurrock. So it is a massive agenda, Councillor Benson, you're quite right. But I think we're looking at those areas. Let's get housing right for autistic and neurodivergent people. Let's get criminal and youth justice right. Keep working on those areas and bring on all those partners together, which is going to be quite a challenge in terms of governance and where that governance goes upwards to try and bring everyone together. I say it's sponsored and led by Adult Social Care, but there's significant recommendations that come from in the report for children's services, education, housing, etc. All of those individuals and senior individuals from all of those areas have been a part of the workshops. So we've got lots of buy-in. So we're really positive, but it is you're quite right, it's a massive agenda in Thurrock and nationally.
Rob wanted to come.
Yeah, can I just come in for very quickly and just and thank Councillor Benson for the question, which I think is absolutely right. I just wanted to say thank you not just to my colleagues for all the work that's been done, but really to the wider community, the experts by experience and the voices that we have been able to engage in. And I think there is the answer to your question. So it's a really difficult challenge. And I'm always minded by 2 things that happened to me when I was in my job in a previous place where we did this piece of work, and actually engaging really actively with the community. I'll never forget being told, don't ever think that anyone is exactly the same as somebody else. We are all completely unique, yeah? And you've always got to respect that. So it is, as Ian said, the challenge is because it is a very, very broad spectrum of needs we need to address. But I also remember very clearly being told what we want is for society to have awareness raised. So it's about the awareness raising, because actually it doesn't all have to cost money. It doesn't all have to be specialist services. There will be some of that, but a lot of it is about raising awareness as to how to engage and communicate. It could be simpler things like lighting. So making sure lighting is particularly bright. It could be how you put your agendas together, so you don't use so many words, you can use pictures, you can use other ways of doing things. It's about asking people in the room what they need to make sure they can engage in that space. So it's about consideration. So I think if we can do one thing out of this, raising awareness and changing people's behaviours, how they approach it, will have a huge impact, which doesn't necessarily have to cost a huge amount of money, and would really help to take us forward a lot.
Thank you. Kerry.
Yeah, some of what I was going to say was actually going to be in a similar vein, actually, and I think we tend to kind of see it as sometimes a problem that there are lots of people that are now being diagnosed when actually, you know, there are some real strengths that people bring from that form of thinking in terms of certain jobs. You know, for example, IT is kind of one. So I think actually starting to see the strengths that people bring and also the vast array of kind of types of people, and the fact that actually most people want the same thing, which is, you know, somewhere to live, kind of, you know, friends and kind of, you know, and kind of being part of something and being able to give something to society. And it's just working out what that looks like from you know, the view set of autism and neurodivergence. So yeah, I think there are obviously some kind of massive challenges, but there are also some kind of real strengths that we need to really kind of make sure that we pick up on, I think, and utilise.
Thank you. And also it is worth noting that it is a full life strategy, so it's from children right through to adulthood. I would mention one thing which I've mentioned to Ian at the time is the increased diagnosis now in women at hormonal stages, so either pregnancy or menopause. A lot are getting, you know, diagnosed with autism or ADHD. Is that something that you're going to be looking into and incorporating at all?
Take it as a recommendation from today that we'll take that to our steering group. We meet next Friday and then we'll add that to our agenda.
Thank you.
It's just a comment. I haven't been able to go to some of the sessions that you've raised, but I'm really, really impressed and excited about the work that you've shared here today. And I think it's something that I guess we've all kind of touched on, but when we live in like a world and a society that's designed around like neurotypical sort of people, like it's very easy to get set in the way of thinking there's only one way to do things and that way is the correct way. When in reality, we've all just been privileged enough to live in a world where things just work for us. But there's a lot of people who have different needs, neurodivergence, autism, and all they really want to do is just access the same things that the rest, all of us do. Like, we're all kind of going after like similar things. So I think the fact that you're centering these voices when you're having these sessions from people with the lived experience, experts by experience, I really like that phrase. I think it's really, really important. And I think you said over 134 people attended. That's really impressive, I think, that you've managed to get that amount of people together to contribute to this. So I'm excited to see kind of how it goes. But it's a really, really important piece of work. And it's going to help our society work better overall. It's an overwhelmingly positive thing. So, yeah, thank you.
Thank you, Councillor Manuel. Yes, as you say, it can be very difficult for a lot of people to navigate their way through very simple processes. I mean, some things can be difficult to navigate if you're not neurodiverse as well. So I think really looking through the lens as to how we can make things more accessible, everything more friendly and easy to use, so that lives are made easier. And I would like to thank, I think we've got Joe's kindly come along today, who's attended both of our informal meetings. So to her and all the others that are attended and really contributing towards the work is really good. And I will be adding that as a recognition to thank the participants. Councillor Spate.
Thank you, Chair, for your indulgence. I think Rob just mentioned something that is really, really important, and that is raising awareness. And if you go back to think about things, one of the things that changed awareness around the world many years ago was a film called One Flew Over the Cuckoo's Nest, which was very visual and actually changed the way, as I say, literally people thought about mental illness, how you would treat people who had mental illness, and whenever it was a massive public statement, and it was engaging. And interestingly, we talk about neuro. I mean, we've just actually had hopefully the same impact by the film I Swear, that's just come out, won BAFTAs, and is going to do, and has done extraordinarily well in terms of raising what is a very complex, difficult to understand situation. And that film alone, I think, will be a landmark in dealing with areas, because people will suddenly become aware. So my plea is to the council, and to not to you guys, you're at the sharp end, you're doing all the graft, is that the council really does get behind it. And it's a drum I've often banged in various committees here. We are really appalling at communicating what we do. And at the risk of having people comment, because I keep saying what a good job they do, Thurrock Fostering, for example, they regularly put out real-time case histories of how fostering has changed people's lives. And they send it out to the media, and they do little film clips, and they get support from National Fostering as well. And they do a really good job of raising awareness. And I think, that as you go forward, and as I said, whoever is the administration taking this council forward next year, that you get the support about awareness, not just about the practical sharp end stuff that you're doing, but spreading that message. Rob's absolutely bang on, and there really are positive stories that about the work this council does, but also about how lives can be improved by people within the community who suddenly realise that the guy next door who's shouting a lot, or the child that's running around the garden screaming and throwing bricks at a wall, there is a reason why that sort of thing happens, and we explain it, and we say, and actually, if you approach that problem in this way, and we give an example, people say, oh, actually, yeah, instead of shouting and bawling, I'll go around and see if I can help. I just think it's really, really important.
Councillor Spate.
Can I just jump back in? So thank you. And as you make reference to that film, which is absolutely right, and the more recent one, can I just throw in, if you get the chance, there's a film that came out in 2020. It's called The Reason I Jump, and it is absolutely fantastic if you get the opportunity. It follows the lives of 6 couples who are non-verbal autistic. It is absolutely brilliant. So if you get the opportunity, maybe another time I'll tell you why I'm so passionate about that film. But it is really worth a watch because it plays into that, what you just introduced there. It's a real insight for neuronormal, Councilman, I had the term perfectly,
Typical.
neurotypical, thank you. It's a really good insight for neurotypical people as to kind of what it's like to live in the world of someone who's got non-verbal autism. Fascinating, thank you.
Ian.
To say, Councillor Spate, yeah, I couldn't agree more. And I'm sure if I didn't mention this now at our steering group meeting, Joe would tell me off. But regular communication with the community, the autistic community, neurodivergent community, but also the community is on our agenda. How we do that, we're not sure. Again, that's co-production. We're not quite sure how to do it. Where we can utilise the council's comms team to get that information out. We're not certain, but we recognise what you're saying. You know, you're going to change attitudes, you're going to change, there's all sorts of things that do that as landmarks and milestones. But yeah, that is on our agenda, very much so.
Question from Councillor Aliki, and then we'll...
Thank you, Chair. Just a quick question just to ask about Oliver McGowan training. Do we offer that in Thurrock to our staff as a mandatory training, just not optional?
Yeah, we've got a 3-year programme to train all council staff. Tier 1 has been in train for quite some time. Tier 2 started recently. I attended myself 2 or 3 weeks ago. It's fantastic training. It certainly changes the way you see the world, very much so. And yeah, the intention is that we'll be working our way through all council staff over the next 3 years.
Okay, thank you both very much. There aren't any formal recommendations. I've come up with a few and see what committee think. So firstly, we'd like to recognise the hard work that council colleagues, stakeholders and those with lived experience have made towards this work. Secondly, we'd like to urge the council going forward to continue the work on this strategy and the ongoing work. And also, Ian has kindly added that he's going to go back to the steering group and look at investigating the hormonal links with neurodiversity and autism. Are there any further recommendations that people would like to add? No? Okay, that's lovely. Well, thank you both very again, and thank you, Joe, also for coming and listening tonight and for everything you do. And we look forward to hearing more as it goes on. Thank you.
I'm looking forward to what comes next as well.
Thank you, Ian. So we will now move to item 8, which is the CQC Inspection Agenda Action Plan. That's on pages 69 to 78. So this is following on from the inspection last May. We had the report to ONS in the autumn, and Rob is bringing back the action plan for us tonight. Thank you.
Thank you, Chair. So just a quick introduction from me. So back in the last year, Scrutiny members will recall that I presented the CQC findings on the adult social care assessment. Just to remind you, the care assessment was undertaken under 4 themes. The first one was working with people. The second was providing support. The third was ensuring safety. And the fourth was around leadership. The outcome we achieved was good, which is fantastic. It was a really good outcome for Thurrock. And it recognised that with all the good work, not just of council staff and our service, but of all the partners that we work with. But there's no room for complacency. There were areas were identified where we know that we can improve on our current performance, and the areas where we really need to kind of address. So what immediately happened was we went through in forensic detail that report and all the points it was making. And we had a very detailed action plan, which I think I had over 57 points in it in the initial action plan. What we've done is we've some of that's been delivered already, but what we've done here, because I can't present that because it's got individual people's names in it and all kinds of stuff, but what I've tried to do is I've tried to group that action plan under 4 things. I say I'm going to come on to a bit who's actually done the work in a second. So what we've done is we've themed it under the 4 themes, and we've ended up with 14 key action areas, which have got a group of actions within them. And that's the action plan that you've got attached here. The broad areas they focus on is around access to advice and information, the need to develop an equality, diversity and inclusion strategy. Equality, diversity and inclusion across the country has been one of the lowest scoring quality markers. There are 9 quality markers which sit within those 4 themes, and that's one of the areas where nationally there's been the weakest performances, an area we need to tackle here in Thurrock as well. The third one is around improving our support offered to informal carers. Then looking at the renewed health and wellbeing strategy, and we mentioned that earlier on today, and there's a lot of work going on in that space at the moment. And just interesting, building on, and thank you, councillors, for the kind comments you made in respect to the previous paper, but making sure we've got an embedded commitment to co-production in everything that we do. Now, I'm happy to take any comments, but just to give you some assurance, how are we going to ensure that these actions are actually delivered and improve the outcomes for the individuals that we're supporting? We have introduced within the Directorate an Assurance and Development Board, which will have oversight of the delivery of this action plan to ensure that it has the impact that we want it to have. I'll pause there other than to say one of the key people, there's been a real team effort, but one of the key people that's been involved in pulling this action plan together is still in the room. So as far as any question is concerned, please look at Kerry, or you can look at BOSA, because BOSA is the principal social worker, and even Ruby helps us on this one, because Ruby's leading on the health wellbeing strategy. So this is something which is across the Directorate. It's been a real team effort, and I've got support here if you do have any questions. But what I really wanted to make sure that you're aware of is that we've got no complacency at all. We've got some significant actions we need to take to move forward to further improve the services within our service area. Thank you.
Thank you for that. So you did mention that you've got governance oversight with the KPIs. I would like to know a little bit more about those markers and how they're being measured and how frequently we'll get to see them, if that's okay, please.
Yeah, we were having a discussion about that today to make sure that our arrangements are robust. So we have an improvement and assurance board that meets on a monthly basis. So the action plan will come to that. So we've got assurance that the actions are right, but not just that, but the measures of success are also right, and that we will kind of be able to get the assurance that we will know when success has been achieved. Because as you'll look at the action plan, there are a variety of actions there. So some will have more quantitative measures, but some will be about actually stages of work being done because they're far broader. So we've got the actions. So each of the leads are now going to be tasked to actually identify what that looks like in terms of what action would be taken place, and actually the anticipated impact and timelines for that, and that will be presented back to the assurance board for sign-off. And then obviously, depending on what's due at what point, will dictate when we expect to see things reported back at the assurance board.
Thank you for that. The other thing, is there any extra funding that's going to be needed for some of the deliverability?
Not particularly, because this is mostly about the way that we work. It's about it's about making sure that we are developing the approach within our work. There will be some things which will require some funding, but they're not specific per se to the action plan. So, for example, the transformation program that we've got within the Directorate around improving our use of digital, for example, is something that we've got within our work programs already. We had a conversation in the meeting that Kerry's referring to that we had this morning. We're talking about a tool that we've got within our care management system. We've got a tool about creating a new portal for access to advice, information and support. So that's there in place already. It's about better utilising some things we already have. So no, there's not an issue for me about having to identify resources to deliver this per se.
Thank you. Would committee like to ask anything on this? No? No? Okay, well, that's good then. So we have got some recommendations. I think to provide comments to support finalising the action plan approach. So I suppose with that, I would just ask that we can see, you know, the regular updates. Kerry referred to like the quantitative details, so we'll have actual KPIs on those. So I would just ask that we can see those and maybe have a timetable with dates. I know that we have got some dates, but they're sort of just either in progress or they're not specific. So if we can see more on that detail, I would think. Agree these actions within the plan to implement formally within the service. Is everyone content with that? Okay. Support the approach to align the action plan with within the corporate dashboard. Could I just have a bit more information on that, please? As to
I've not got myself quite prepared for that meeting yet. That's next Thursday night. We've got corporate overview and scrutiny. But basically, not for next Thursday. Before you get into that one, and by that, that's really for next Thursday night. Effectively, there are some indicators which are service, yeah, and they don't need to be reported broader, but there's some which are more important. So, or not more important, so that's wrong. There's some which are going to have a higher profile. So, for example, health wellbeing strategy. Our approach to reablement, our reablement offer, they already sit within the corporate performance dashboard. So it's making sure that and so you're aware that the roadmap has got the corporate performance ONS next week. We'll see the corporate indicators aligned to the roadmap, and it's ensuring that those indicators that sit within the service, which also are part of showing the journey of improvement for the council that we're making within our directorate, but feeding to that wider council bit, are aligned. So they're not we're not repeating, but we're kind of aligning into one thing. So you'll see some things here, but you'll also see them in the corporate roadmap performance board as well.
So it's basically saying that the actions here are going to be linking up with all the different strategies and the corporate. So there is mention of the supported housing strategy here as well. So that's basically what that recommendation is saying. Is everyone happy with that recommendation? Lovely, super. Okay, thank you very much. Right, so we shall now move on to item 9. So that's the work programme. And that is on pages 79 to 82 of the agenda. Claire, would you like to take us through that?
Thank you, Chair. As the committee will be aware, this is the last meeting of the municipal year, and we are beginning the process for the 26-27 work programming. We'll be meeting with the Chair and directors in coming weeks as part of that process, so that we have a potential draft work programme to provide to the committee and members in the new municipal year for further comment. So we have that for the work programme. I'll hand back to you for the next one, Chair.
Thank you. So moving on from what Claire was describing as the meeting that's going to be held, I'm considering whether, depending on committee thoughts, of having a sort of feedback session of what we've done this year, reflection on what you think we've done well, what we could have done better, and also what anyone themselves would like to see going forward. If there is support or keenness for this, we can look at holding that. I think we were looking at the 2nd or 3rd week of March, and it would probably be on a Teams meeting, if that's something that committee members would be interested in, and then Claire can circulate some dates if there is a need, if So we're getting a few nods. So, yeah, okay, yeah, okay. So we'll liaise with some dates on that in the coming weeks. Thank you, Councillor Spade.
Yeah, I think that's a good idea, and I think a sort of wash-up session would be quite good. One thing, I mean, it sort of comes under the action log as item 10. In terms of the sort of legacy of things still to do, I mean, and the action log shows there are quite a lot of amber ragged issues that will go through to the next municipal year, and of which some of them should have considerable weight behind them. I did mention a couple of meetings ago, I really feel that this committee should be looking at the health, air pollution issues in the borough, and that's not on the work programme or the action log. And I really think that at the very least we should do is stick a flag on the board to say it's something that we would hope that whatever the formation of this committee is, it works. And we know it's going to have to be sort of cross-directorate and get involved with place, which is what we said before, but we shouldn't forget about it.
Burton, we have got it down, but I can hand over to Ruby as well.
I apologise, Chair, I'm a complete imbecile. There you go, you've got it on record.
That anyway.
Thank you, Councillor. There's a lot of work, just to give reassurance, that's ongoing. And just that it will be brought, and I think I can just add that, you know, we have had meetings and there is discussion about having a sampling strategy. It'll come later in the year once we get the results. Thank you.
Thank you, Ruby. Did you want to say something, Councillor Hooper?